Hello, my name is Professor Willem Odendaal. I am the CEO of KuduQ Consulting, and you can find us at kuduq.com. What I want to talk about today is I'd like to show you that we are not left with only flattening the curve as the only option to deal with a pandemic. There is actually a way to reshape the COVID-19 curve or a pandemic curve and remain within the healthcare capacity of the economy of that particular locality, as well as simultaneously saving the economy without having to flatline the economy or putting it into comatose state. So we can therefore get ahead of the curve and take control of it instead of remaining behind the curve and letting it control us. So before I continue, I just want to show these graphs. These are the type of curves that we'll encounter. The first one is the blue curve, which shows new cases. This is new cases of infections. It could be new cases of symptoms or hospitalizations or deaths, something like that. This is plotted on a graph which has as the x-axis days or dates, and on the y-axis it starts at 0 and it goes up to a certain number, which is the number of people. Now, this is an idealized curve, but this is generally what it looks like. And what it shows is that the number of cases will exponentially increase and then suddenly slow down and reach a peak, and then start declining until it reaches back to 0. Now, instead of showing the new cases, if you just add up all the cases every day and get the sum total, we call it a cumulative number, you get the red curve. This is the so-called logistic function, and here you can see what's happening. It's exponential up until a certain point when there's an inflection which corresponds to the peak of the blue curve, and the blue curve now is merely the derivative of the red curve, or the red curve is the integral of the blue curve, since it's the sum total. At this inflection point, the rate of infection starts slowing down. And this is because the virus runs out of susceptible people as more people become infected. It doesn't have any victims anymore until it's run out of victims completely, and the number stabilizes. The total number of infections stabilize because there are no more new infections. This number need not be the total population. This is important. The percentage of the population that gets infected is called the infection rate, and this could be a significantly small number, or it can be a very large number. It could be 90%. It could also be 0.9%. It all depends on how well mitigation is done, or if people wash their hands and stay away from each other. It also depends on the characteristics of the virus. It depends on whether it's a city or a rural area. There are so many variables. The fact is that it doesn't have to be the entire population. Now, when we look at typical pandemics, you see there is a curve that we call the herd immunity curve, or the unmitigated curve, which is this red one. And that just shows you what the virus would have done if we didn't do anything, if we didn't try to stop people from getting into contact with one another. But to flatten the curve means that we want to get this peak much lower so that it can fit our healthcare system, so that it doesn't cripple the healthcare system and overwhelm it. The problem is that even when you flatten the curve, it doesn't flatten it really, it only scales it down. So it still remains exponential with this nasty peak, but it's not a flat thing. So if you look at your healthcare capacity, that is pretty flat, and it intersects the blue curve, which is the flattened curve, twice, here and here. So if you then divide the blue curve according to where these intersections occur, you can see that there are three situations. In the beginning, there is complete underutilization of available healthcare for a long period of time. Then suddenly your healthcare is crippled and overwhelmed by overdemand. And then the healthcare capacity is again underutilized because there are not many infections. This is very poor utilization of the healthcare system during the entire pandemic. The other thing I want you to notice is that when we flatten the curve, we also stretch it out in time. So the length of the pandemic becomes longer the more mitigation we impose. What Americans also quickly found out is that as you increase mitigation, there is a negative effect. And that is that economic activity is inversely proportional to level of mitigation. Of course, because as people are taken out of the economy, economic activity ceases. When you apply full mitigation as a step function like here, you also do the inverse with the economy. So the economy that would have done well suddenly goes down to zero in activity and flatlines in activity. This does not mean that the economic health is flatlined. The economic health is free falling. This is worse. The economy is essentially suffocating and being asphyxiated to death. This is completely unsustainable and must end as soon as possible. Here is another plot that I want to show, and that is on the red curve is the herd immunity. The blue curve is this flattened curve, and then the green curve is some hypothetical curve that we could get if we did so much mitigation and containment that we could get the thing completely well below the staffed bed capacity or the healthcare resource capacity. And what I want to show you is that the more the mitigation we do, the more it stretches it out in time. But this graph doesn't clearly show you how long the pandemic lasts. And the reason for it is because it goes to from zero to a very large number. So you cannot actually see when there is 100 people or 200 people or 1,000 people at the end of these curves that are still infected. And you might want to decide how many people would you tolerate being infected before you end containment. Because the more mitigation we do and the more we protect people from getting infected, the larger and the bigger the population that is still susceptible to the virus. You let the virus loose in a susceptible population and it can explode once again. It is like dessert for a virus. So in order to solve that and get a better idea of the extent of the virus, we have to plot it on a logarithmic scale. A logarithmic scale works in decades. What this means is that we, instead of going from zero and having the same constant increase per division, we are actually multiplying. So this one goes from 1 to 10, and to the next division it goes from 10 to 100, and then from 100 to 10,000, and to 10,000 we multiply by 10 each time to 1,000,000. And now you can see that these curves look like icebergs under the water. The damage is now much more visible, and the extent of these things are much longer than we anticipated just looking at the previous graph. The longer we mitigate, the harder we mitigate, the longer the pandemic, and it is severe. So how do we reshape the curve? To reshape the curve, we use engineering methods to control and use mechanisms that are for mitigation, but we do it in a very controlled manner. And if I plot the unmitigated herd immunity curve next to the flattened curve again, there is a better curve that would shorten the pandemic as short as possible in duration and keep the amplitude well below at the available healthcare. And that is a rectangle that looks like something like this. So this is the smallest curve that we can fit below the available healthcare and the shortest duration that starts the soonest. So to get the pandemic over and done with. However, an ideal curve like this is impossible to accomplish. We cannot go from zero to something like that. So we can, however, approximate something like this, which is more trapezoidal function. And what you'll see is that it doesn't have this nasty peak. We can get it below the healthcare, and we can actually also make it shorter. This curve is actually completely programmable. We can even shape it in ways to accommodate things like, let's say, changing needs, like a field hospital that opens up in the middle of the pandemic. Please go to kuduq.com to look at this, because when you do this, you also give the economy breathing room and boost the economy back to health while you relax controlled mitigation. So it's a way of relaxing mitigation and boosting the economy at the same time and getting the economy back online. Please go to kuduq.com. Please spread this around, share it, like it, tweet it, put it in Facebook, let your friends and let your everybody know. The more people that know about it, the better. Thank you for watching. My name is Professor Willem Odendaal.